Good afternoon, everyone. I'm Perera, and our study is on knowledge, attitudes, awareness of ischemic heart disease and medication adherence among ischemic heart disease patients attending medical clinics at CSTH Hospital, Kalubowila. In our study, we have used the term medication adherence. It is a term which is generally used interchangeably with the term compliance. So it means the degree to which a patient follows the recommended treatment with regard to the dosage, timing and frequency. Whereas the act of continuing to take any amount of medication for the prescribed length of time is called the persistence. Ischemic heart disease is one of the major atherosclerotic cardiovascular diseases, and this slide shows the global and local statistics on ischemic heart disease. So, ischemic heart disease is the leading cause of death globally, causing 8.99 million deaths worldwide in 2021. And in Sri Lanka too, the leading cause of death remains ischemic heart disease, causing 70% of total deaths in Sri Lanka in 2019. So even though the global mortality rates due to ischemic heart disease are rising, in high-income countries they have managed to reduce their age-standardized cardiovascular mortality rates through improved CVD care and better risk factor management. In contrast, in low and middle income countries, where 3/4 of all CVD deaths occur globally, the problem is deteriorating. It is worsening. So this is due to increasing rates of diabetes and obesity, and due to lack of primary and preventive health care in the background of limited healthcare infrastructure and constrained funding. So interventions focusing on risk factor modification and optimization of pharmacological management are identified as plausible strategies to mitigate this trend in resource-limited settings. So it has been observed that improved cardiovascular health literacy was associated with increased medication adherence and improved control of hypertension and diabetes and lower rates of cardiovascular readmissions. Therefore, it is important to evaluate the cardiovascular health literacy in our setting in the form of knowledge, attitudes, and awareness in order to plan strategies to reduce ischemic heart disease burden. So, our objective was to assess the knowledge, attitudes, and awareness of ischemic heart disease and medication adherence among ischemic heart disease patients attending the medical clinics at Kalubowila Hospital. To be specific, we wanted to assess the knowledge regarding the epidemiology and the risk factors of ischemic heart disease and determine the level of medication adherence, and to identify predictors for knowledge regarding ischemic heart disease among these patients. So we conducted a descriptive cross-sectional study at CSTH Hospital, Kalubowila over a period of 6 months. So there we recruited consecutively selected patients who were aged above 18 years and previously diagnosed as ischemic heart disease by a consultant physician with at least 3 months of attendance to medical clinics at Kalubowila Hospital. So we analyzed the data using t-tests and chi-square tests, and the significant variables from those were included in binary logistic regression model to determine the expected predictors of knowledge. We used the ischemic heart disease fact questionnaire to assess the knowledge, attitudes, and awareness of ischemic heart disease. This was created on the body of existing research studies and expertise of cardiologists and practicing clinicians. And the Moisky medication adherence scale was used to assess the medication adherence and to identify reasons for non-adherence. And a pilot study was conducted at Kalubowila Hospital, and the data was excluded from the final analysis. When looking at the results, our sample consisted of 402 individuals whose age ranged from 40 to 49 years, and the majority was male, singular, and belonged to the age category of 60 to 69 years. Surprisingly, most of our participants had never smoked and never consumed alcohol. And the more common comorbidities associated with ischemic heart disease in our participants were hypertension and diabetes. The key finding is that our participants had a moderate level of knowledge regarding ischemic heart disease with a mean score of 3 plus or minus 2 out of total of 15 marks, and over 80% of the patients scored above 6. That means moderate and above level of knowledge was there in over 80% of the participants. Going into depth, almost all the participants had accurately identified the risk factors. However, only 45% of the participants were aware that ischemic heart disease is one of the leading causes of death in the world. And about half of the population was aware of the normal values of blood pressure and blood sugar values, whereas nearly 90% of the population was aware of the importance of healthy dietary patterns and physical activity in the management of ischemic heart disease. We also assessed the medication adherence. So we assessed the medication adherence qualitatively. So in our sample, they had a satisfactory level of medication adherence, and it is notable that only 3.5% have stopped their drugs thinking that their condition has returned to normal, and only 5% have stopped their medication due to side effects. And we also took a look at the targets of medical management. Most of the participants had normal BMI, while the other parameters were suboptimal. So the significant variables were included into the binary logistic regression model, where the educational level and BMI, high cholesterol levels, and diabetes mellitus were identified as independent predictors for knowledge of ischemic heart disease in our study. So in conclusion, the overall knowledge, attitudes, and awareness about ischemic heart disease among participants were moderate, but the treatment targets were suboptimal despite having a satisfactory level of medication adherence in this population. And we identified educational level, BMI, cholesterol levels, and diabetes as independent predictors for knowledge. So we recommend implementing health education programs at clinic and community level to address gaps in knowledge on ischemic heart disease and treatment targets. And we hope to utilize these study findings to enhance quality of care and patient engagement in ischemic heart disease management. And it is best to conduct further research on effective risk factor management in order to reduce ischemic heart disease burden in low and middle income countries. These are the references.